Hi there. This video is about some changes we've made to our request test template and some changes we're going to make, at least at the Welby Group, about how we request repeat tests when filing results. So I've got a patient's results here. Some have already been auto-filed, some need review. Now it might be that once I've reviewed them, I think I want to repeat them, or some of them. So if I mark the report as reviewed, up till now at least at the Welby Group, we would click repeat test. You might then put some notes in about which ones need repeating or timeframes and things like that. That causes a lot of extra work downstream though, because someone then needs to look at that, identify the correct ones, identify the timeframes, and add them to the request test template, make sure they brought in, and so on and so forth. So what we're planning to do instead is take that option off, and what we'd like our clinicians to do is use this request one-off test template that you're already familiar with. Now, the changes we've made are partly to facilitate this changed approach about repeat tests. So we've kind of put more information in here, and we've changed what information is displayed and added some more in. So you can see here, for example, that this patient's recently had a change to their diabetic medication. And so about 12 weeks after that date, they'll be having a HbA1c. Now, in one sense, that may not affect at all what you do, but it might be useful because you might decide, actually, yes, I want to repeat this test, but actually, do you know what? If I put 2 months, that's going to roughly line it up with that. And the two things would kind of come together. The date that's here, the 12 weeks after, is a kind of rough approximation. You can never be precise exactly when a blood test will be repeated. We would invite patients a few weeks before that, there's kind of 12 weeks after that date. With this, it works slightly differently. That date is the trigger date to invite the patient. And if it was done before that date, you would then try and repeat it again. So I might say, actually, do you know what, I'll aim on the early side. But basically, that will kind of do those blood tests together at the same time. I would also click repeating tests. That will in time do a couple of things. One, it will let our broader systems know that this is the outcome for the patient. So we can text the patient, for example, and say, you've got repeat tests that are due, or repeat tests that will be due, and we'll let you know when those are happening. Also, when staff take the bloods and it's on the recall overview, we will make it so that the repeat test then displays as the primary kind of reason for that. There are other things that will be displayed here. So if, for example, EGFRs drop below 60, they've not got a CKD diagnosis, so that we're going to repeat it in 3 months' time, and the pathology system would pick that up. That will be displayed here. If there are blood tests that have been taken but aren't back, that will display. If there are other future dated requests on here, again, that will display. And again, you might want to think about lining those dates up. Another thing we might look at doing that's sort of percolating my brain at the moment is whether it might be helpful here to see as well quickly, how often does a patient have regular bloods? So if, for example, you saw that, I don't know, this patient, say they're on methotrexate, and so they're having 3 monthly LFTs, FBCs, and using these anyway, that might again change how you decide to manage it. I'm not a clinician, I don't know, it's up to you, but what we're trying to do is just give you the tools to make that an easier process. So let's say that's what we're going to do. We'd okay that. System will run some checks in the background, obviously, whenever I okay this template, which I think is why it's suddenly gone slow, perhaps also because I'm recording. Then when you've done all of that, you would mark the report or the battery is reviewed. So repeat test won't then be an option. I think you'd just click other because it's not a no action. I guess it would be probably an abnormal. You could add presets in to say, repeat test added to request test template. It's not there at the minute, but that might be one to add in. And that will be it. We think that's going to be safer and more efficient and better longer term, and hopefully also avoid kind of unnecessary bloods or duplication of repeats and things. But it's early days of development, so let us know how you find it and any ideas, and we will, of course, keep working on it. Thanks.